Patients from across the Midlands are to play a major part in a new study which will examine how survivors of COVID-19 recover from the illness. Some patients are known to recover quickly, but others could be suffering from long-term problems. A study led by scientists in Leicester has been awarded more than £8 million in government funding. Gareth Owen reports.
Amidst the terrible death toll, many thousands of people across the country have recovered from COVID-19, some against all the odds. But while each is a cause for celebration, there's no way of knowing exactly what the future may hold for them. Alex Guerrero was on a ventilator at Glenfield Hospital in Leicester. He was seriously ill and he recovered, but still, 3 months on, he is suffering from COVID-19's long tail.
I tire myself quicker than before. Before I could, go about my day and wouldn't have a problem. A couple of weeks ago, I tried to mow the grass in my backyard. It's not a massive yard. It's about 10 by 15 meters. And I could only do half of it. And I had to go and sleep for 4 hours because I was really tired. My lung capacity is just not what it is. So what it used to be. So I found myself gasping from air.
And for some, the aftermath can be even worse. There are worries about permanent organ damage. Meanwhile, others appear to have a quick and complete recovery. That's why the hospital trust which treated Alex is now leading the UK's biggest research programme on COVID-19 survivors. 10,000 patients will be recruited and studied for after effects. One of the investigators is Dr. Rachel Evans.
This is a really important study to really find out for those people that were hospitalised and were discharged from hospital. We really need to find out what's happening to them now. What symptoms have they got, what problems have they got, and what can we do to help. There are a lot of people that make a full recovery, and that's part of what we want to look at, is who recovers really quickly and has no further problems and why, and who actually may develop longer term problems. And why.
I'm really excited that they're doing this because, as I said, we don't have the data, and I really hope that I hope that I can participate in this because obviously I want to help.
COVID patients in the major hospitals in Birmingham, Nottingham and Leicester will now be invited to join the study. It won't stop COVID-19, but it might help us to manage the aftermath. Gareth Owen, ITV News.